Chapter 4, Routine Blood Collections. Preparing for venipuncture. We need to make sure that we have our equipment, okay, and we have that right equipment. So the selection, what supplies do we need? Do we have a phlebotomy station? Is it stationary? Is it portable? Our items need to be within easy reach. Avoid placing things on the bedside table. Again, we don't know how clean that is, and so we don't want to lay those things on that bedside table. Evacuated tube system is going to be the most common. The supplies we need is gloves, isopropyl alcohol swabs or pads, gauze pads, tape, tourniquet, and needles. So with that evacuated tube system, blood is going to be collected into glass or plastic tubes. The tubes have a vacuum or a negative pressure. When those tubes are attached to the needle with a vein, it aids in the flow of blood into those collection tubes. So each type of tube is designed to collect just the right amount of blood required for the tests to be performed from each tube. Never remove the stopper because that's going to get rid of the vacuum. The colored stoppers identify each tube and indicates which additive is contained inside. The label will show what additive is in the tube as well, the expiration date, the amount of blood that the tube will hold. The anticoagulant tubes or the plasma, they're used when the blood test requires the blood not to clot. Most commonly include our culture, our light yellow, light blue, light green, green, purple, royal blue, and gray tubes. Additives are going to be specific to the blood test, so the phlebotomist needs to know the appropriate tubes to use for each test. Using the wrong tube can alter the test results. So our evacuated tubes can also contain a gel separator, which is going to assist in processing the blood after the tube is centrifuged. With the syringe method, we're going to use this typically for patients who have fragile veins that collapse easy. So just think of a straw. If you would suck on that straw really hard, it would pull it in, which collapses it, and that's what the veins are going to do. So with the ETS tubes, which contain that vacuum, the collection of blood from the patient happens at a rapid rate, and we can't control that. With the syringe method, it allows us to manually adjust the rate that the blood is withdrawn from the patient, so we have control over that, which helps prevent collapsing those veins because there's not that suction or that vacuum that's pulling it rapidly. We're controlling that. Most of the supplies that are needed for the syringe method are going to be the same as the ETS system. We need our glove, alcohol, gauze, pads, bandages, tourniquet, collection tubes, and needles. Evacuated tubes are used, but not in the blood collection process itself. Other supplies would be a syringe and then the transfer device. The transfer device, I will show you next time in class. We pull from the syringe, we put the syringe on the transfer device, and that then transfers the blood from the syringe into the tube. Our winged infusion or butterfly method, this is going to be used when a patient has veins that are small or sometimes difficult to access. We are also going to use the butterfly method when we're drawing from a hand. The supplies, again, are very similar to that ETS method. Gauze, gloves, alcohol pads, the adapter, bandage tubes, and so on. The difference is really how that butterfly attaches to the adapter and how it's used to puncture the patient's skin. Equipment quality is very important. We have to make sure that we check all the equipment before we use it. So we're going to visually inspect the needle before and after removing the cap. We want to make sure that the seal on that needle between where the cap comes off, where it exposes that needle, is intact. And then once we pull the cap off, we want to look at the bevel of the needle, so that end of the needle where the opening is at, and just make sure we don't see any metal flakes or anything else there, because we don't want to introduce a foreign body into the patient's blood system. We need to make sure we inspect the package as well, just making sure it's intact, and just looking that needle over real well. We want to make sure that the date is current, so we don't want an expired needle. And again, the label and the seal. Of course, needles should only be used once. Safety devices should always be deployed. Once the needle is inserted into the vein, if we miss and pull the needle out, it has to be put in the sharps container. You cannot reinsert that needle. Once it's in, if it comes out, it stays out. We would place the sharps in the container right away. Never lay the needle down on the patient's bed or phlebotomy tray. And dependent on the facility, tourniquets are usually a one-time use. Selection and preparation of the site. We need to make sure we observe the patient's arms and ask the patient. So maybe they have an arm that works better than the other. We're still going to look at both sides, but we can still kind of take the patient's input. Tattoos, scarring, hematomas or bruises, any injury, IV with fluid running below the IV, we wouldn't want to go into those areas. Some patients prefer a certain arm again to be used. Some have a reason why one might not be able to be used. So like if they've had a mastectomy or if they have a fistula. So we need to make sure we ask those questions and that we look for ID bands. So if someone can't have blood drawn out of one arm, they would have a pink band on that said restricted extremity. If we don't see that, it's still good habit to ask the patient if there's one that they can't have used. We're going to start by palpating the arm that the patient prefers, then move to the other arm and choose which is best. Adults, we really like to go in that antecubital area. Our first choice would be the median cubital vein. Our second would be that cephalic vein, and then our last choice would be the basilic vein, and then we could go into the hands as well. Usually if we're drawing from infants, our first choice is going to be the heel. Tourniquet application and removal can be single or multi-use. Again, it's going to depend on the facility. Usually the tourniquets are single use. It's going to be placed 3 to 4 inches above the antecubital area. Now the antecubital area is at your elbow, so the crease of your elbow there. If you're using a hand, you would place above the wrist bone for that dorsal collection. We're going to apply it gently, but we need it tight enough to assist in finding the vein. So we want those veins to kind of pop out. The tourniquet should not be left in place any longer than a minute. After 1 minute, then the hemoconcentration can begin. After the application of the tourniquet, then we're going to start to palpate. So we're looking for a vein that feels spongy, feels bouncy. We want to always palpate with the same hand and finger to just train our brain to find those veins easily. We usually use our non-dominant hand. Once you find the vein, follow it with your finger to determine the direction that it's going in. Again, not all veins are going to be straight. Ways to help the vein be more prominent. We can hang the hand or the arm, use a warm compress, or rubbing the area. A lot of the times, rubbing with some alcohol wipes will help a little bit as well. The antiseptic application, again, we always want to make sure we're wearing gloves. We're going to clean the site with friction using a back and forth stroke. Allow that alcohol to dry thoroughly before you proceed with your venipuncture. If repalpation is required, we need to repeat the cleansing process. Some patients are allergic to alcohol, so we need to make sure that we're asking allergies. Those allergies are important even when we're drawing blood. Different cleaning methods for different collections. So cultures are going to use a little bit different method of cleaning. And then dermapunctures we're still using alcohol wipes, but we do it just a little bit different. This is just a picture of showing how to anchor a vein the correct way and the incorrect way. And this is venipuncture insertion process. We're going in at about a 20-25 degree angle when we're going into the skin with the vacutainer system.